My name is Jillian Seaton, and this presentation's purpose is to provide insight on the app Calculate by QMD to determine if it is a reliable source and can be recommended for use among healthcare workers. Calculate is 100% free and is available for use on Apple devices, Android tablets, smartphones, and via internet access. The purpose of this medical application is to guide clinical practice for nurses, physicians, risk management, and education in the healthcare environment. It accomplishes this by highlighting tools that help professionals to manage symptoms, calculate formulas, assist in diagnosing, and classify appropriate next steps of care. When signing up for the app, the user will answer multiple survey questions that provides information on what specialty they have experience in. This will trigger the app to auto-generate scoring tools and evaluation information to help guide the user's specific field of practice. This application is kept up to date with current information and integrates appropriate resources based on the user's specific clinical practice. It converts publications from PubMed, the CDC, and documents from READ QMD into tools. This helps nurses to prevent mistakes and increase positive patient outcomes. There are more than 400 functional tools to help guide clinical practice and can be used for both bedside nursing and education in healthcare. These are just a few categories that benefit from the utilization of this app. The general calculator function provides quick answers to weight-based medication doses and ideal body weight for patients. These calculators generate answers immediately and avoids having a loading delay. The specialty section for emergency medicine includes tools to guide the plan of care for injuries and trauma, pediatrics ER, and managing airway issues. For critical care specialties, there are tools to calculate mean arterial pressures, systematic vascular resistance, cerebral perfusion pressures, Glasgow's coma scale, and much more. The anesthesiology section provides tools for preoperative assessments, risk for respiratory failure, and appropriate endotracheal tube sizes along with sepsis risk scores. The layout is initially arranged based on the answers to the original questionnaire filled out by the user. There are options to search for specific calculators to help guide clinical practice or for educational purposes. It provides immediate access to resources and allows the user to browse for tools by specialty, or you can simply search what you are looking for. The unique question flow is based off a survey style. A diagnostic question is presented and prompts the user to answer before moving on to the next step. This process is repeated until the result is formulated. It is a user-friendly app with scoring tools set up in a survey style to easily maneuver. The questions are automatically previewed so that the user can assume time management. The results are easy to understand and immediately accessible. The app trends your history so that if needed, the user can instantly revisit the tool if appropriate for practice. There are no apparent legal or ethical issues within this app. There is no requirement to input patient identifier information, and although there is a trended history of what calculators were previously accessed, the results from prior use are not saved, protecting privacy. This app does not replace a plan of care or orders, but rather helps to outline appropriate actions for the nurse. Because this app is free, information is collected via cookies and is exchanged with third-party companies to guide advertising campaigns and to continue the delivery of relevant content for application users. However, this does not pose as a legal or ethical issue because the user agrees to terms upon usage of the app. Calculate is a broad app that guides clinical practice with calculator tools and reference material. It helps to reduce clinical errors and provides current information for users. It is time efficient and provides instant access to original reference materials. Additionally, all information is kept up to date. It is important to understand that this application is a tool to guide steps in care and should not be used when it interferes with ordered plan of care. There is limited accessibility of information for Calculate and is mainly outlined only on the QMD website. Overall, this app can be deemed a good resource for healthcare workers. Calculate has over 400 unique tools to guide and improve quality care delivery. It was developed by clinician experts for healthcare workers and uses up-to-date publications directed towards any field of specialty. It is a reliable medical resource and can be recommended for use.